Hello everyone, good evening. It is about 8:40 p.m. here and about to end my shift as a lab professional. The week has been good. It has been a customer week. At least we celebrated kidogo. So at the end this week, I want to discuss something about my life as a lab professional. My routine on a daily basis, what we do in the lab, challenges that we face, and maybe what the future has for us as lab professional, considering the technologies and the artificial intelligence that is currently in place. So as a lab professional, we just analyze the body fluids, tissues, cells, just to provide an accurate results that helps in guiding your doctor to make decisions about your health and help him in providing treatment. And most of the time we work behind the scene just to try and uncover the truth about what is happening inside your body. So we actually analyze everything in your system. We ensure science supports the history and they are linked with the truth. So generally, my normal routine on a daily basis, when you come in the morning, you go through two different sections. We have the phlebotomy where we do blood collection. That is obvious, something that you have to do on a daily basis. And quality results begin from there by collection of a quality sample, following all the standard guidelines that are provided. Then you run through different sections such as clinical chemistry, where we try to analyze substances in the blood such as glucose levels, things such as cholesterol, lipids, that is, things like creatinine levels, to try to understand how your kidney is functioning, analyze some enzymes that helps in providing information on how well your liver is performing, things like proteins within your system such as bilirubin, albumin, you have bilirubins. So that is clinical chemistry. That is a section that you have to go through each and every day. We have the hematology sections where we generally analyze your blood cells, checking HP levels, trying to find out diagnose things like anemia, leukemia, and many blood disorders and platelets disorders in the hematology section. We have the immunology section where we do serological tests, we analyze conditions like HIV, hepatitis, syphilis, and many more in the immunology department. We have blood transfusion where we try to prepare blood, ensure that it is safe to be transfused, ensuring it is compatible with the recipient, that is the patient. So we do a lot of cross-match blood grouping there. That is all about blood transfusion. We have microbiology department where we try to identify bacteria, parasites, viruses that might be causing infection, things like fungi. All those things you go through on a daily basis. We also have histopathology. This is where we process your tissues and cells and send them to the pathologist to try and examine whether the cells are abnormal or normal and find out whether you are developing cancer or not. So generally, those are some of the departments that you have to run through on a daily basis. You arrive in the morning, you have to check your patients in the ward, whether there is a test there to be done. You go to the ward rounds, you take samples, and you check. Then you continue with the normal routine of receiving the patients and those that are coming from the clinic. So all these are important and very crucial in health. And All this matters because 70% of all the medical decisions are based on the lab reports. So if you give out a peculiar report or a false report, then the patients are in danger, and even the decisions that the doctor will be making will be wrong. So every test and every slide, every report is beyond a commitment and accuracy, responsibility, and patient care. All those men must consider accuracy, must be responsible, must be detailed in everything that you do, because this report plays a very important role in trying to provide diagnosis to the health of a patient and to guide your doctor. Early and accurate diagnosis, detection of a disease saves life. So the early and the better you do it, the more lives are saved. Lab plays also an important role in public health, especially when there is a pandemic or an outbreak of an infection. For example, previously the coronavirus, lab played a very crucial role there in helping to diagnose such. So that is a very important department and profession. So as a lab professional, there are some qualities that you need to have that will help guide you to provide quality results, accurate results, and reliable results. So you need to be precise. You need to be very precise in your report and the result that you produce. By precise, it just means that you need to produce a reliable result, a result that if someone else comes in and do the same test, then they come up with a result almost similar to what you produce, a result that is similar to what you produce. That is, must be precise always in what you do. You must pay attention to details. Every details of the patient, you must take account of it, as that will be guiding you on what to expect or what not to expect in the results. You must have strong ethical standards. You respect the patient privacy. You communicate well. And you relate well with everyone. You must always be curious, trying to know more, trying to learn more, always ready to learn new things, because science evolves each and every day and things change each and every day. Whatever you believed in yesterday, maybe today you find that it has changed. So you must always be able to learn and update yourself with changes that comes in anytime. You must also be a team player. You coordinate well with your colleagues, with the nurses, with the doctors, as all this will be towards achieving one goal of ensuring the patient gets better. So you must always maintain all these qualities to ensure that accurate and reliable results at the end of the day. So integrity is very key in the lab. Always be truthful. We normally say that in the lab we give out the exact representation of whatever comes in. So if you bring in a poor sample, you will always get a poor result. Bring in a quality sample, a quality result at the end of the day. So there are also some challenges that we go through, like too much workload at times comes with the pressure from the client, pressure from the doctor wanting the results. But you need to adapt to all these ones, and you communicate well and give accurate time. There is always constant exposure to infection, because in the lab we deal with the infections. We detect the infections. That's what we detect. So all the time we will be interacting with the infection, the bacteria, all that. So you need to maintain all the standard guidelines that is required while operating in the lab. be protective to yourself, like always in gloves, putting on mask when necessary, being a lab coat. All that is very important to ensure that you are also safe as much as you interact with very many infectious samples. So medical laboratory profession is not just about machine and test tubes. It's about saving life, providing answers, and giving hope to patients. Nowadays, many people, when they go to seek medication and they are not sent to the lab, they will ask questions why, and they will feel like they didn't get the correct treatment. So lab profession is very important. It also has quite a number of advantages as a profession. Currently, all the people that I graduated with, none of them is jobless, even if maybe it is not to the standard they want, but I'm 100% sure that most of them are doing something, and 90% of them are in a clinical setup. So in terms of job availability and job demand, jobs are there as a lab profession. Lab profession is recognized worldwide as long as you are licensed with the correct regulatory bodies. You can work anywhere. You can do just exam like ACPI, can work in the USA. You just have to do certain exam. Can work in the United Kingdom. It's a profession that is recognized worldwide. So it is a very good profession. So far, so good. I enjoy that profession. Thank you. Click the link on the bio. Subscribe to my YouTube channel. That is the only favor that I want from you as the viewer. Thank you very much. It will mean a lot to me. Asante.